everyone, good morning, happy Saturday. Sitting out with Dr. Emer's office. We are going to be doing Morpheus on our patient's forearm, so you can see I've already marked out the area. This is, especially lately, an area that a lot of patients are coming into saying, I want my skin tighter. And some of the areas that tend to accumulate sun damage and signs of aging are the hands and the forearms. We're driving, we're always outside, we wear short sleeves, and you develop a lot of crepiness kind of at the elbow, sometimes by the wrist, pigment and color on the hands. And so the combination that we're doing today is going to use radiofrequency microneedling to deliver a lot of RF tightening into the skin throughout the area. And then we're going to piggyback it with a Fraxel treatment. And the Fraxel will be good at lifting up any signs of damaged cells, pigmentation in the skin, and also be used to reduce the occurrence or likeliness of skin cancers. So you get a lot of benefit out of this little combination. So I've done actually one little test spot just right here, and you can see it's not too red. You may see it. And we're just gonna continue and go box by box until we've covered the entire area. We just use topical numbing and our patient is super comfortable. So this is a great treatment to get a little bit of in-office tightening, and it's something that lasts a while. I always tell people there's no expiration date on the tightening that you get from this. It's just that we can't slow down the aging process. We can't stop the time, but actually we can slow it down when we incorporate treatments like this. So you just want to use these kind of back to back up front to really get a few great treatments and some momentum on your skin tightening. And then after that period of achieving the goal, then we can just space out the treatments, maybe incorporate a couple others. Maybe we do a Clear and Brilliant or a Venus Legacy that's good for tightening, and we just build on it. So we're going through the entire area. This is our patient's a skin type 3. She's a good candidate skin type wise for a lot of treatments, but the great thing about this treatment is if someone has a potential to hyperpigment or you're worried about the risk, this really doesn't give you a lot to stress about because the needles are coated. So they're coated with gold, and the coating essentially means that there's no heat being delivered to the surface parts of the skin, and that is where the potential for pigmentation lies. So by sparing the surface and only delivering energy to the depth of the skin, then you are getting the results without the risk. So we do add in brightening treatments or skincare at home for patients who are very dark, just as a precaution. But this is a treatment that's good for any patient, any skin type, any area of the body, whether it's just tightening for anti-aging or if they want to improve on acne scars, a little bit of fat reduction in the jowls, fatness, the fat and the tightness, you can actually target both with this. So there's a lot of really unique ways that you can combine the treatment for each individual. I just want to show you that I've done this box, and when you're nice and close, you can see a little bit of pink, but not a whole lot else is happening yet. So this will develop a little bit more color. We'll see. I'm going to move over to this one. But other than that, the aftercare is simple. We follow a good aftercare regimen for all our treatments in the office, and downtime is very minimal. She'll have little baby scabs. They'll just feel a little bit sandy for a while, and then they'll flake off, and the tightening starts to kick in. So great treatment all in all. This was Morpheus8. It's made by InMode. It's very similar to Fractora, a couple little differences. Are there any questions there? No, not yet. Everyone's still sleeping? If you guys have any questions about this, let me know. I'll reach back out, but I'm going to finish up her treatment, and then I'll tune back in when we move to the Fraxel. Thanks, everyone. You doing okay? You seem pretty relaxed.